Welcome back, ladies and gentlemen. Today, we're diving into a topic that affects millions of people worldwide, a condition that often goes unnoticed until it starts causing serious trouble. Get ready to explore the intricate world of atherosclerosis and peripheral artery disease. Peripheral artery disease is no small matter. It's a widespread circulatory condition that silently creeps into our lives, affecting the peripheral arteries responsible for carrying oxygen-rich blood to our limbs. Imagine a road with constant traffic, suddenly narrowing down to a mere trickle. That's precisely what happens within our bodies, as these vital passageways become constricted, reducing blood flow, and causing a whole host of issues. But why should we care about peripheral artery disease? Well, my friends, understanding this condition is key to maintaining our overall health. Whether it's the tingling sensation in your legs, the cramping pain while walking, or the increased risk of heart attacks and strokes, peripheral artery disease can profoundly impact our well-being if left untreated. That's why, in today's video, we'll embark on a journey through the intricacies of peripheral artery disease. We'll demystify the underlying causes, delve into the risk factors that could make you more susceptible, and reveal the steps you can take to prevent or manage this condition effectively. Together, we'll uncover the power of knowledge and empower ourselves to make informed decisions about our health. Are you ready to arm yourself with the understanding you need to combat peripheral artery disease? Let's get started. But first, before we dive into the details, make sure you hit that subscribe button and turn on the notification bell, so you never miss an episode of our health and wellness series. Alright, let's kick things off and take control of our circulatory health. Welcome to the world of atherosclerosis and peripheral artery disease. Number 1. Blocked arteries. Now that we've set the stage, let's take a closer look at peripheral artery disease or peripheral artery disease. Simply put, PAD is a circulatory condition that primarily targets our lower limbs, causing a decrease in blood flow due to narrowed or blocked arteries. However, it's important to note that peripheral artery disease can occur in other organs or body parts as well. Number 2. Plaque. When we talk about peripheral artery disease, we often refer to the peripheral arteries, those that carry oxygen-rich blood away from the heart and towards our extremities. These arteries can become narrowed or blocked over time due to a buildup of fatty deposits called plaques. This condition is known as atherosclerosis. Number 3. Cramping and discomfort. As the plaques gradually accumulate, they restrict the blood flow, leading to a range of symptoms and potential complications. While any organ or body part can be affected by peripheral artery disease, it is seen most in the arteries of our legs. The reduced blood flow can cause pain, cramping, and discomfort in the legs, especially during physical activity. Number 4. Claudication. The legs have a significant demand for oxygen and nutrients, especially during exercise. When the blood flow is compromised, it can't keep up with this demand, resulting in symptoms known as claudication. This is typically experienced as aching, cramping, or fatigue in the legs, which subsides with rest. Peripheral artery disease has systemic implications beyond the legs. Untreated, it can result in non-healing wounds, infections, and tissue death, potentially leading to amputation. Early detection and management of peripheral artery disease are vital to prevent these severe consequences. To prevent and manage peripheral artery disease effectively, let's delve into the causes of peripheral artery disease. Understanding these insights provides valuable guidance for addressing this condition and its impact on the lower limbs. Number 1. Atherosclerosis. One of the primary causes of PAD is atherosclerosis, which occurs when plaques made up of cholesterol, fat, calcium, and other substances build up within the arterial walls. Over time, these plaques can harden, narrow the arteries, and impede blood flow. Factors contributing to atherosclerosis development include high cholesterol levels, smoking, diabetes, obesity, and a sedentary lifestyle. Number 2. High blood pressure. High blood pressure, or hypertension, puts excessive strain on the arterial walls, making them more prone to damage and the accumulation of plaques. Elevated cholesterol levels, especially high levels of LDL or bad cholesterol, contribute to the formation of plaques within the arteries. Smoking not only damages the blood vessels directly but also promotes the buildup of plaques. Diabetes, especially when uncontrolled, can damage the blood vessels and increase the risk of atherosclerosis. Obesity and a sedentary lifestyle can lead to weight gain, elevated cholesterol levels, and increased blood pressure, all of which contribute to PAD. Number 3. Genetic factor. Genetic factors. While the above risk factors play a significant role in the development of PAD, it's important to remember that they are not the sole determinants. Genetic factors, family history of cardiovascular diseases, and age also contribute to the likelihood of developing PAD. Furthermore, individuals with existing cardiovascular conditions, such as coronary artery disease or stroke, are at an increased risk of PAD. Identifying and addressing these risk factors early on can help prevent or manage PAD. Regular screenings, such as ankle-brachial index (ABI) tests, can detect the presence of PAD even before symptoms arise, enabling timely intervention. Lifestyle modifications, including regular exercise, a healthy diet, smoking cessation, and managing conditions like hypertension, diabetes, and high cholesterol, are crucial in reducing the progression and complications of PAD. PAD is primarily caused by atherosclerosis, where plaques made of lipids, fibrous tissue, and calcium accumulate within arteries, narrowing them and limiting blood flow. This leads to insufficient oxygen and nutrients for proper leg and peripheral function. In addition to atherosclerosis, PAD can also result from sudden blockages caused by blood clots or emboli. These obstructions, originating from different body parts, can disrupt blood flow and contribute to PAD. In rare cases, vasculitis and arterial injuries can contribute to PAD. Abnormal tissue formation and anatomical features can also restrict blood flow. Although less common, recognizing these causes is crucial for accurate diagnosis and personalized treatment of peripheral artery disease. Understanding the symptoms and progression of peripheral artery disease. Number 1. Intermittent claudication. The impact of reduced blood flow becomes most noticeable during activities that demand a higher blood supply, such as physical exertion. People who are less active may not initially experience symptoms due to lower demand for oxygen and nutrients. However, one of the telltale signs of PAD is intermittent claudication. Intermittent claudication is a hallmark symptom of PAD, characterized by leg pain during activities that subside with rest. Other symptoms include color changes, coldness, impaired hair, and toenail growth. Calf claudication, pain in the calf muscles, is a key indicator of PAD due to atherosclerosis. Number 2. Critical limb ischemia. As peripheral artery disease progresses, the symptoms can become more severe and widespread. In advanced stages, a condition called critical limb ischemia may develop. This is characterized by constant pain, even at rest, slow healing ulcers or sores on the legs or feet, and in severe cases, tissue death is known as gangrene. Critical limb ischemia is a serious condition that requires immediate medical attention. Number 3. Acute limb ischemia. In some cases, PAD can also lead to a medical emergency known as acute limb ischemia. Acute limb ischemia occurs when there is a sudden blockage of blood flow, usually caused by an embolism or thrombosis. It is important to recognize that acute limb ischemia is a medical emergency that poses a significant risk of limb loss if not treated promptly. Diagnosing peripheral artery disease involves a thorough evaluation of symptoms, medical history, and a physical examination. During the physical exam, healthcare professionals may observe signs such as weak pulses in the affected limb. Whooshing sounds are known as bruits, indicating obstructed blood flow, and evidence of poor wound healing in the legs or feet. Blood tests are commonly performed to evaluate cholesterol, triglyceride, and blood sugar levels, as these can contribute to the development and progression of atherosclerosis. Additionally, the ankle-brachial index (ABI) test is a frequently used procedure to assess blood pressure in the ankle and arm, with an ABI lower than 0.9 indicating the presence of peripheral artery disease. Imaging procedures, such as ultrasound or angiography, may also be employed to identify and visualize the affected arteries. When it comes to treating peripheral artery disease, the goals are multifaceted. The primary objectives include relieving symptoms, restoring adequate blood flow to the affected limbs, preventing limb loss, and slowing down the progression of atherosclerosis. Treatment options may vary depending on the severity of the condition and individual patient factors. Lifestyle changes, such as adopting a heart-healthy diet, regular exercise programs, smoking cessation, and weight management, play a crucial role in managing peripheral artery disease. Medications may be prescribed to control blood pressure, lower cholesterol levels, manage diabetes, or prevent blood clots. In some cases, procedures may be necessary to open or bypass blockages in the arteries, such as angioplasty, stenting, or bypass surgery. As we come to the end of this video, it's crucial to recap the key points we've discussed regarding atherosclerosis and peripheral artery disease. We explored how atherosclerosis, the buildup of plaques in the arteries, is the major cause of peripheral artery disease. These plaques consist of lipids, fibrous tissue, and calcium, gradually narrowing the arteries and reducing blood flow. We also touched upon less common causes, such as sudden artery blockages by blood clots or emboli, blood vessel inflammation, arterial injuries, and anatomical abnormalities. Understanding the symptoms and progression of peripheral artery disease is vital. Reduced blood flow manifests most prominently during activities that demand higher blood supply, leading to intermittent claudication, a telltale sign characterized by painful or tired legs while walking, relieved by rest. We discussed additional symptoms like leg and foot color changes, coldness, lack of hair growth, and toenail abnormalities. As peripheral artery disease progresses, it can result in critical limb ischemia, causing constant pain, slow healing ulcers, and even tissue death. We highlighted the connection between atherosclerosis, peripheral artery disease, and other arterial diseases, underscoring the importance of understanding risk factors. If you experience symptoms related to peripheral artery disease or have risk factors associated with atherosclerosis, it's crucial to seek medical attention promptly. Early detection, proper diagnosis, and appropriate treatment can significantly improve outcomes and reduce the risk of complications. Thank you for watching this informative video on atherosclerosis and peripheral artery disease. We hope you've gained a better understanding of these conditions and the significance of managing them. To stay updated with our future content on health and wellness, don't forget to like and subscribe to our channel. If you find this video helpful, please share it with others who may also benefit from learning about atherosclerosis and peripheral artery disease. Together, let's raise awareness and promote circulatory health. We appreciate your support and look forward to bringing you more informative videos in the future. Take care of your health and until next time.